The story is, I woke up one morning and I didn't have enough strength to get off the couch.
I had a pretty strong indication that something was seriously wrong, so my wife and I drove over to the emergency room at Milford, and you know, things kind of went very quickly from there.
It went from, you know, swine flu, then he had to be intubated, to, okay, now he has acute respiratory distress, his lungs shut down, and then it just went from there. My
kidneys were failing, and my blood count was plummeting.
And it got to the point where when I was breathing a breath, saying to myself, this could be my last breath.
Well, my mom visited the ICU in Milford Regional Medical Center dozens of times over the last almost 10 years of her life. She was a person that was living with secondary progressive multiple sclerosis.
The ICU is where the sickest people go. I don't think you can really run a quality hospital without a good ICU. People need to be prepared for what happens, and the ICU is where you go when bad things happen.
The individual attention that I got, to me it seemed like I was the only person in the hospital. I mean, I just had this team of people, and from my perspective, I was the only patient they had. And I know obviously they had others, but it just seemed to me that I just got their focused, undivided attention.
They explained what they were doing, why they were doing. They asked questions, but they made you feel that it was important what you were telling them.
The 20+ towns that we serve, we consider our community. And in our hospital, patients are people, and we know them by name. We know family members by name. They're not a number. And I think that's very important.
With my mom being a ventilator-dependent individual, she could mouth her words, but she couldn't speak. And they never treated her with any disrespect or any disadvantage because of that. They talked to her, they read her lips, and I was able to be there and help them in any way that I could.
We can take care of their medical needs, we can provide tests and diagnosis and medicine, but we can't give that emotional support that they can only get from their family and loved ones. And if they're being cared for at some of the bigger hospitals to the east and west of us, then sometimes their families can't get there.
I mean, I can't imagine having to go into Boston. That would have been, I wouldn't have been able to do that, not with the kids, the grandchild, you know, it just would not have worked.
The visitors are a key part of intensive care. They need to share in the experience and help us make the patient better.
Even in his room, there was a chair. That's what I got to sit in, like a regular chair. It wasn't a recliner chair, it wasn't a comfortable chair. And it, you know, it's no fault to them right now, that's what they have.
Well, the new ICU is going to be awesome. The rooms are much bigger, the technology will be better. We'll really be state of the art, and we will correct a lot of the problems where we haven't been able to provide good facilities to families. So they'll have better sleeping quarters, better private space.
I think anybody considering a donation to the new building expansion project should consider that when they are investing in this project, they are investing in the community.
They would be investing in the future, in our future, in their future, in the future of their children and their grandchildren.
It's a little bit like insurance, so I think it's an investment in something that you never want to use yourself.
One day I was healthy, the next day I'm in the ICU. Knowing that, I think it's really important that people realize the value of an ICU and the value of having a better facility.
Even if it doesn't happen to you, it's, you know, something will happen to somebody that you know, and I think to have this facility, this capability in the local community is just a benefit to all of us. So I think it's a great cause to support because it helps everybody here.
We have lived in another part of the country where this kind of, if I was there, if we were living there, I wouldn't be here. There's no doubt in my mind. I mean, there's not even a question.
You don't know when you wake up whether you're going to be healthy at the end of the day, and it's nice to have some excellence nearby.